right. Thank you so much for meeting with the Natal Network today. Can you introduce yourself?
Hi, I'm Mia Rosemary Burnett. I'm a certified surgical physician assistant.
Okay, perfect. And so, my first question, I'm not even going to waste time with you because you are a healthcare professional. What was it like going from being a practitioner, a PA, to being a patient?
It was difficult because you're on the other side. Um, it gave me clarity, the patients that I do see, and to sympathize with them more and actually understand what they're feeling emotionally at that given time.
Yeah, that's good. Okay. And now we'll get into the C-section portion, okay?
Okay.
So, as we all know, birth can be a very traumatic experience in life. A lot of times it gets brushed under the rug. So, today we are going to get into what it's like to have these different experiences, and you divulge any knowledge you want to. Go as deep as you want, okay?
Okay, thank you.
So, how many C-sections have you had?
3.
Three, okay. And do you feel that the experience changed with each one?
Yeah, it did.
Okay.
Absolutely.
In what way?
So my first one, it was scheduled because my daughter was breech.
Hmm.
We tried an inversion, but of course she turned back in her comfort state. So we had to schedule a C-section. It was scheduled for 7:30, but there was an emergency, so I had to be bumped down to 9:30, which of course I had a lot of anxiety for waiting. My second child birth, and now it's a C-section because she's breech. But other than that, it went fine. There were no issues. I remember the doctor that delivered me, we were friends. And so she said, everything works. Her plumbing, she peed as she came out. So it was a warm, welcoming experience the first time around.
Okay, that's good. So, have you heard of gentle C-section before?
Never.
Okay, so now we have something called a gentle C-section, which is more patient-centered. Now, for all my healthcare people listening, we know patient-centered care should be the norm, but now we have something called gentle C-sections,
Okay.
which means you now are allowed to have a family member back. So now most of the time the husband is back there, or the mom, whoever is that one person in your life. But now they allow dimming of lights, they involve candles, a little music playing. Do you think if you were informed of that decision when you had them, that that's something you would have wanted to do?
Well, when I had my first C-section in 2009, yes, my child's father was there as support. They did play music. Again, I did work for that facility, so I experienced all of those things. I didn't have the title as gentle C-section, so I never heard of the title, but I did have those experiences.
Okay, that's good. So you feel that certain measures were taken to make sure you were comfortable?
Absolutely.
Okay, excellent. So that was your first one. Can
Yes.
you give us a little insight to the second one that you
So
had?
my second one was in 2012 at a hospital in Tampa. It was supposed to be a VBAC. That was the goal, to be a VBAC. But I was laboring for like 18 to 19 hours, and I was tired. Again, natural. So I had no meds on board.
Yeah.
And I remember my nurse said, "Stop being a martyr. Stop being a martyr. Take the meds." But I was so adamant to have a natural childbirth because my first childbirth experience, it was natural. The second, of course, because of her being breech, we had to do a C-section. But this time I was like adamant, I had my birthing plan, which I already know when you do a birthing plan, how things go the opposite way. So, given that, I was just adamant to not have any meds on board and to truly, truly have a vaginal birth. Well, again, after the 18, 19 hours of laboring and really not progressing, I actually said, "Get the OR ready. I'm tired. I can't do this anymore." So, and at that time, my physician, surgeon, of course, change of shift came. That's when things kind of went downhill for me. So we get towards the back, and the said doctor chooses to give me a vertical incision, which there was no reason for.
Oh gosh.
Besides him stressing that, my husband said that I had a lot of adhesions. My husband is not a physician, so I really think that the doctor should listen to the patients because prior only had one C-section. And it's a norm, of course, any surgical procedure, you're going to have some adhesions. But if you're a OBGYN, you've done multiple surgeries, adhesions should not revert to me getting a vertical incision. And that's what he gave me.
Wow. Now, for those who don't know what a vertical incision is, can you elaborate for us?
It's an incision, if you think about where your ribs are, going up and down. If you're going to make like an eye, I got a vertical incision on my abdomen. And then, so that's the second incision I got. So now, if you look at upside down T, I had the fan still for my first one, so now I got a vertical. And there was no reason why I should have had a vertical incision.
Wow. Did you ever get any clarity as to why he decided to do that?
He said because my husband said I had adhesions. Sorry.
So, okay. So he went off what your husband said.
Exactly.
Okay. Who is not a physician.
Yes.
Okay. Wow.
Yeah.
That is some insight for you. Now, being a person in healthcare, at this time, were you an RN?
No, I wasn't an RN, but I was in the medical field.
Okay. I was asking because I know you said you were an RN, then you went to PA. So I was asking because I wanted to see what your thoughts were being a person that is already in the medical field, but you were in the medical field either way. Okay. Wow. So did you ever get any sort of reconciliation with that situation?
No, it was a hard healing, recovering process.
Okay.
Number one. And then I had to deal with the emotion side of it because I was angry because now I had this scar on my abdomen, which was not called for. There were no emergencies. Usually we give that incision when you're trying to, there's like life or death situation. Mom or baby life is in detriment. But there's no reason for a control situation. I labored for 18 hours, had no issues, no meds on board. There's no reason that decision should have been made. And actually outside of the patient, talking to the patient, So no, I had to deal honestly, spiritually and emotionally, just kind of let that go and focus on taking care of my child at the time. But I was very angry because now, like I said, my recovery was harder. I had a dehiscence because of that. And then when I tried to research, the doctor was gone. He was no longer with the facility anymore. He went back to wherever he had came from. So it was just that wasn't the best experience for me.
Yeah. So for those that know, dehiscence is when the wound ends up opening. Okay, very nasty situation. I actually have had patients when I did home health that I had to go and take care of those exact things. They can become smelly, very badly infected, and very painful. So let's talk about the recovery processes a little bit. Have you had 2 C-sections or 3? Okay. So, we went over the first 2. So was recovery different for both of them?
I think so. The first one, we understand that you're going to have pain, in that area. You have your meds on board. We're advised to have a pillow or something to support the wound if you cough, sneeze, when you have your first bowel movement, all those things. That's understood. But the second one, like I said, because of the type of incision, it was harder.
Yeah. Did you feel, now we're going to get into it, did you feel like if you were not a black person that this incision would have happened?
To be even clear, the surgeon was black.
Ooh!
It's so disappointing.
This spices it up.
Yeah.
Okay, wow.
Yeah.
Okay, so sometimes it's just lack of care.
I think it was lack of care. He was ready to go. That's the doctor that came in to relieve my surgeon. Because me and my surgeon, we had a plan. We had a great camaraderie with one another. I worked with him, versus someone that came in and relieved him. We did not have that bond.
So that continuity of care wasn't there.
I definitely know it wasn't there.
Okay.
In fact, my other doctor was not going to give me a vertical incision. We were really focusing on VBACing.
Okay. Oh, okay. Have you ever had the chance to have you have. You've had one vaginal birth then?
Yes.
Okay, good. Now, if you have a preference, which one would it be? Some women say they prefer C-sections now.
And I say all the power to them. That's all I can say because it's a lot of work. Has the rise of C-sections increased? I believe so. I've done a lot of C-sections since 2018. This is just outside of internship. And I was just like, oh my God, why are we calling these C-sections? So it definitely has increased. I would prefer a vaginal birth. I think it's the most natural way. I think when there's harm to either mom or baby, yes.
Okay.
Yes. But I don't think it should be because the doctor's tired, doctor's ready to get off the clock, there's vacation pending. I don't think it should be that way. And I can honestly say it has been that way.
Yes.
Unfortunately.
So now, when you say it's been that way, in your own experience with your own children, have you seen that happen with the staff you've worked with, where you know this is the reason why the doctor wants to do a C-section?
I know what I've seen in my experience is that, especially for a first-time mom, it could be longer. I don't think it's discussed as much and given clarity on how long your first experience could be. I mean, some moms, you could come in there and you think, oh, you're gonna have a baby in 4 hours. Not. It's far and few between if that does happen, but most times a prime will probably deliver within, you'd be good if you get in at 8 hours. You know, some 12. And if you got meds on board, it might stretch it out, it might be longer. So for every woman, it's different. Every practitioner practices different. So it just truly depends. It depends. I advocate, exercising, having, a doula, someone, that extra support system, because you should have, you have to advocate for yourself. But people that don't know, they just go by whatever the practitioner is saying, and you do have a say in your care. But it's a frightening time, exciting. There's a lot of emotions with birth, so sometimes people get lost in that excitement, I should say. There's a lot going on.
Yeah, that is great insight. That is really great insight. We thank you for that professional and personal view on there. So, if you could change any part of your birth experience, what would it be?
My birth experiences. Honestly, it would be my second C-section. That I'm still dealing with that scar.
Yeah.
So yeah, that second C-section. I wish now, I'm like, oh my God, I should have just. If I had the strength to muster through, a couple more hours, I probably would have. Because when they were pushing me back, my water broke. So I was so close, but I was so tired. So if I just would have had that probably additional support, I think I could have weathered through it. But I just was so tired, and the only one that could understand is a mom laboring for 18 hours with no meds could understand when you're just tired. You're like, I just want to be over with it, and that's just where I was at, unfortunately.
Okay, yeah. Yes, and labor will do that to you. It's one of those things where you kind of don't have a choice. You don't have a choice when it starts. You don't have a choice when it ends. Okay, so after your C-sections, do you feel like you had enough instruction to care for yourself at home? Were you given sufficient discharge instructions?
Yes, they gave sufficient discharge instructions, yes.
Okay, and do you feel that you had enough support at home?
I'm going to say yes, but I also will say that people come to visit the baby. They focus on the baby, and I think that's just a routine thing. People are so happy for you. They want to come see the baby. They want to come see you. The focus is morely on the baby, and then they leave. And then you're left with the baby, and then either baby is woken up, right? And so now when they say sleep and the baby sleeps, the baby is up, so you can't sleep. So for my third C-section, I think I finally got it down. I had a provider, thank God for my church family. Someone came to take care of the baby, and someone came to take care of me, and it was greatly needed. And I was able to get rest. So they did like a 6-hour shift. One came, between like 6 to I think 6 to 1. The other one came 1 to 7. So that helped me out. I was able to sleep, take a shower, do those things that you really can't, do without having that support system there.
Oh, that's excellent. We're going to shout out to the church family.
Listen,
you guys get connected to a church family.
Yes. Yes.
Wow.
Yes.
So with the first 2 C-sections, you said you did have sufficient help, but I guess you really noticed the difference when you actually have people coming to work shifts and help you, right?
Like I said, I finally got it right the 3rd time around. You have to have that person in place because I forgot to mention that I was allergic to the pain meds. We found that out. So nothing was really helping me when I was at home. So I wasn't able to do much. And then I think I had my meds on the counter, but I was on the couch and I fell asleep, didn't take them. So that pain, when you're not taking it in that intervals every 4 hours, it is significant. So my doctor said, no, you need to take them every 3 hours. You need a buffer. You can't wait the 4-hour mark is not working for you. And I got in a kind of scary situation that I was literally paralyzed in pain, could not move. So I had to just text help to somebody, and they were the one that advocated and got the 2 church members to come help me because they're retired. They could do it. They want to do it. It's just that it was a really scary situation.
Oh, wow.
Keep your meds close by. Do not have them on the counter and you're in a different location.
What were you alert? Was it opioids?
Yeah, it was. I think I want to say it could have been Vicodin if I'm not.
Okay.
It was Vicodin.
That is such a common allergy.
Yeah.
You hear a lot of women say that they are allergic to it and they don't know what to do in that situation. Oh my gosh, did you break out into hives?
Hives and whelps.
Yes, yes.
Yep, hives and whelps.
Okay. Now, had you known about doulas back then during the birthing of the children?
So honestly, I thought doulas were just for mothers that have vaginal births. So I personally had a doula. Her name was Gloria. She was a lifeline for my 3rd C-section, and she was amazing. She was amazing. I even thought about becoming a doula because of her. She was so informative. She came and visited me. She was throughout my whole third C-section pregnancy, I should say. She came to my home. She helped with different resources. She came to the hospital when I was getting ready, when I checked in for my 3rd C-section. She was already in recovery, when they were closing me and took the baby back. When I walked in, she had the baby in her hand. She helped put the baby on me. It was just an amazing experience. And when I was covering an L&D about, I want to say 2 years ago, who walked through the door was her. And it was just the best feeling ever. And so I could reassure another patient who she was taking care of that you are in the best hands. I can tell you from my personal experience. And I just think having personal experiences really helps you to be the best practitioner ever.
Yeah.
I mean, a book can't teach you that.
Yeah.
A book cannot teach you that.
What's the saying? Life is the best teacher.
Listen, a book, I mean, it's theory, but until you get in that clinical mindset, it's different. And then when you are that patient, the bar is risen.
Mm-hmm. Yeah, okay. Well, look, we need to find Gloria. Hey, Gloria, you got raving reviews.
Yes.
I hope you see this somewhere. You did a phenomenal job.
Yes.
So I want to ask you, what are some encouraging words that you can give to new moms, to seasoned moms, to doulas, to anyone undergoing C-sections?
Honestly, hydrate, be graceful, get connected. It truly takes a village. My 3rd C-section was, I want to use the word amazing because things were put in place. I am a very, private person, although I've been sharing more of my health issues with everyone because I think that the taboo is so large that people don't want to share the information. thinking that we are alone in it when there's so many other women that are dealing with the same thing or something similar. And because everybody does, I don't want anybody in my business, people are dying because people don't know. Lack of knowledge, and people are dying when all it takes for you to share, especially at this platform now with social media and things like that. This is something great to share with other women. So I think just hydrate, be graceful, and get connected. Get connected. There are so many other resources and programs out there. And like I said, I didn't even know that doulas came to C-sections. But through another resource told me that, and I was like, okay, sure, I'll take a doula, not even knowing what a doula was, and it really was beneficial for me.
Excellent. And how'd you find the doula program? Did you go through the state or?
I want to say I read it in an article at the doctor's appointments, and I believe when I asked questions about it, oh, that's for women that are doing vaginal births, you're doing a C-section. So I was kind of remiss about it. And then when I was going seeking information about another program, and then it was brought up to me again. I'm like, really? And I said, well, I thought you couldn't do if you have a C-section. They were like, who told you that? Yes, you can. So that's how it just came from word of mouth. For me, just really questioning it, can I have a doula? And they was like, absolutely.
Excellent. So ask lots of questions.
Ask lots of questions. And if someone tells you no, still ask somebody else. Because again, I was told that service was for vaginal births only.
Yeah. Yes, that is not true. So doulas, we do prenatal care, we do birthing, there's abortion doulas, postpartum doulas, support doulas, we support
even with adoption. They help, because I could be honest, and I'll say this, and I could tell my son when he gets older, my youngest, that's how, it was through that resource, through the adoption agency, where we found the doula, because at that time, I was separated, and I didn't think that bringing another child and being able to responsibly take care of that child financially and even emotionally, that resource, that adoption agency helped me with the doula, and they were the one that gave me the information that, of course, we'll be there with you every step of the way, and they were. And, through the process, God was like, no, we're going to keep him. We're going to name him this. And I kept him, and here we are, and he's 9 years old. So it was a great experience.
Oh, wow. Okay. Yeah. So we have motherhood from all angles from you, Rosemary, all angles. Okay. We have the practitioner. We have the L&D nurse. We have the adoptive parent. It is beautiful. Oh, well, thank you so much for your time. This was a very unique interview, and I know you will bless so many with it.
Thank you. And that's the goal. That is the goal. To share and encourage and help and support other women. That's my goal.
All right. Thank you so much. And did you enjoy being interviewed by the Natal Network today?
Absolutely.
Thank you.